I do think that the health system now has begun to understand that the patients need a role and in fact deserve a role and ethically should have a role. But I think it's terribly hard for some professionals to not see themselves as the experts and therefore the only experts. It's a matter of us working together to find ways of talking to each other about situations where we're coming from different directions. In the late 70s, I had a rare bone disease, and that exposed me to a lot of the health system, good and bad. So a few years ago, when I had to have my 2 deformed hips replaced, I'd learned a lot about how to help myself in the health system and how to encourage health professionals and teams of health professionals to work together with me. By doing that, by engaging a respiratory physician because I had lung constriction and pulling in all the other things that I knew I would need, I ended up in being 1 day less in intensive care than had been predicted, 3 days less in the hospital than had been predicted, a week less in rehab than had been predicted, and I didn't need the respite care that was planned. For me, that demonstrates not only that consumers have to take charge for themselves about the things that go on, but they have to learn what to know and how to ask the questions. And if we do all that, we actually save the system as well as ourselves lots of stress. I hope that not everybody has to have 40 years experience of bad health to get to the point where they know how to manage themselves in the health system.